I'm Mary. I'm going to be your nurse today. Is now a good time to perform an examination on your abdomen?
Yes.
Yeah, okay. So I'm going to go ahead and provide patient privacy and perform hand hygiene. So the first thing that I'm going to do is go ahead and just check the symmetry of her stomach, okay, by stepping at the foot of the exam table. So her stomach looks symmetrical. I'm also going to check if there's any masses, any bulging, and any pulsation. But pulsation doesn't necessarily mean that it's abnormal. So when I'm looking, I don't see any masses or any bulging from her stomach, so that's a good sign. I'm also going to just check her skin color, see if there's any hair on her stomach, and see if there's any scars. So do you have any scars on your stomach?
Yeah.
Yeah? Oh, so she does have a scar on her stomach from her C-section. And I'm also just going to check the skin color, so her skin color looks normal. Okay. So now I'm going to go ahead and auscultate her stomach. Okay. Okay. So I'm going to go ahead and start at the first quadrant, second quadrant, third quadrant, and fourth quadrant. Okay. So her bowel sounds are hyperactive and normal, and while I was doing that, I was also listening to any gurgling sounds. So now I'm gonna go ahead and listen for any bruits. So I'm gonna go ahead and start at the aorta and making my way downwards. I'm gonna do this with the bell of my stethoscope. Okay, so I'm gonna go ahead and start. So I'm gonna start at the aorta, okay, and then I'm gonna go to my left renal artery, my right renal artery, make my way down to my left iliac artery, my right iliac artery, okay, I'm gonna go down to my left femoral artery, my right femoral artery. Okay. So there were no signs of bruits. Now I'm going to go ahead and percuss her stomach, and I'm going to go ahead and listen to any tympanic sounds, which is the drumming sounds, and make sure there's no dullness. Okay. So I'm going to go ahead and start. Okay, so there was no dullness in the stomach, and if there was, then that would indicate free fluid, which is not a good sign. Okay. So now I'm gonna go ahead and percuss for the liver sounds. I'm gonna start from right above her belly button, making my way upwards. And I'm just going to keep doing this until the tympanic sounds changes to dull sounds. Okay, so it's going to be right around here. So now I'm going to go ahead and start from around the 11th or 12th intercostal space and make my way down. Okay, so it's going to be right around this area. And I'm going to go ahead and just mark the liver span. It's about 4 to 7 centimeters. Okay. So now what I'm going to do is just percuss her spleen. So I'm going to have you just switch. I'm just going to check your left side. Okay, just go ahead and move on. Okay, so it's going to be around this area, and I'm just going to percuss around it just to check for any dull spots. Okay. So if there was fluid in her stomach, I would go ahead and do I would check for it. So what I would do is just put my arm right down her stomach, and I would have her shift from back, side to side, and just to feel the fluid. Yeah. And then after that, I would percuss to see if, where there is no fluid. Now I'm gonna go ahead and palpate her stomach, starting from the first quadrant and making my way around to the fourth quadrant. And while I'm doing this, I'm also just gonna check the skin turgor and her temperature. Also, do you feel any pain in your stomach? No? Okay, good. So I'm gonna go ahead, palpate stomach. Okay. So everything feels normal. Right. So now I'm going to just carefully palpate her liver, which is going to be in the left upper quadrant. So I'm gonna go ahead and ask you to take a deep breath for me. Okay, do you feel any pain when I do that?
No.
No? Okay. So if she did have any pain, that would indicate gallbladder inflammation. Okay. So now I'm going to go ahead and palpate her spleen. The spleen usually isn't palpable, but if it was, then it would mean that the spleen is enlarged, which is not a good sign. So I'm just going to go ahead and palpate her spleen.
Okay.
So I wasn't able to palpate her spleen, which is fine. Okay. So I'm also just going to palpate her kidneys, but the kidneys also, they're not palpable, but you would find them right down here, around this area. Okay. So now I'm just going to palpate the aortic pulsation. It's just going to be right above her belly button. It's right here. Okay, so I'm palpating it. Okay. And if I was able to palpate it, it would indicate an aneurysm. Okay. So now I'm just going to check for rebound tenderness. So you're going to tell me if, so I'm going to go ahead and press down and release quickly. And you're going to tell me what hurts more, okay? So.
No.
Neither?
No.
Okay.
Neither.
Okay, good. So that concludes our abdominal examination. Do you have any questions for me?
No.
No? Okay, so I'm going to go ahead, provide patient privacy, and perform hand hygiene. Thank you.